Good morning, students. Welcome back to psychology session again. Today we are going to study about classification of psychological disorders. Students, all disorders, be it psychological or physical, need to be classified because the treatment is directly dependent on its type and the causes. For proper diagnosis and treatment plan, one needs to know which type or category of disorder it is. For physical disorders, the classification is mainly based on the root cause, that is the etiology. Unfortunately, the causes for various psychological disorders are explained differently by various perspectives and theories in psychology. We have just studied criteria for the abnormal behavior, where you might have noticed that there is no reference of etiology or causative factors. The main emphasis on the cluster of symptoms or syndromes. Now what is this? This means certain symptoms occur together in one particular disorder. So classification of mental disorders keep on changing. Presently, there are two major systems to classify psychological disorders. Number one, DSM and second, ICD. The first one, Diagnostic and Statistical Manual for Mental Disorders. It is published by American Psychiatric Association APA. It is mainly used to ensure uniformity of diagnosis by mental health professionals. The present version of it is DSM-5 was introduced in 2013. It contains 22 broad categories of mental disorders with many subcategories. Second one, International Classification of Diseases and Related Health Problems ICD is created by the World Health Organization. For documenting all types of diagnosis, diseases, signs and symptoms and social circumstances. It contains a section on psychological disorders. According to the ICD-11, there are 19 broad categories of mental disorders. This was presented in 2019, most of which overlap DSM-5. It is not possible to study all these categories of disorders in just one chapter. So students, will limit ourselves to only few common disorders. The first one is anxiety disorder. The word anxiety is derived from the Latin word anxietus, which means uneasy or troubled mind. When a person feels nervous or worried without any obvious reason for a long time, such that it starts interfering with the daily life, it is called anxiety disorder. Students, please go through the Hema's example from the textbook. There are many sub-varieties of anxiety disorders, but we still study two major anxiety disorders, namely generalized anxiety disorder and phobia. Let us go to generalized anxiety disorder. Students, we all feel tense in our daily life due to various reasons. For example, during exams, while speaking in public, etc. It is sometimes beneficial to experience mild tension while shouldering responsibilities or while facing a difficult situation. It compels us to face difficulty in systematic and planned manner. But instead of mild or moderate tension, if it becomes too intense, it starts interfering with our daily routine as well as our work performance. We start feeling tensed or nervous without any reason. We start avoiding people and are unable to perform daily routines. Now, to diagnose any individual suffering from this disorder, the symptoms should be present for at least 4 weeks for children and for 6 months for adults. Due to extreme nervousness, his capacity to solve problems may break down. Of course, as we have already seen, there is not just one criteria to be fulfilled for diagnosis of any disorder. So, consultation of the expert is essential. Now, what are the symptoms? Extreme fear of unknown, increased heartbeats, irritability, frequent headaches, frequent worry, lack of sleep, sensation of vomiting, uneasiness, breathlessness, blackouts, etc. are observed. The second type of disorder is called as phobic disorder. Students, the word phobia is derived from phobos, the name of a Greek god of fear. We all are afraid of something or the other, and we normally are able to overcome it with little efforts. But even when something or some situations are either less dangerous or not dangerous at all, if an individual is intensely afraid of it and that creates problem in adjustment in daily life, then that fear is called as phobia. For example, some people have fear of height, some have fear of water, fear of darkness, fear of animals, fear of insects, fear of blood, or being in the crowd, or being alone in the elevator. So all these are different types of phobias. Then the individual tries to avoid it at any cost. If he starts interfering with his or her daily life and creates adjustment problems for more than 6 months, then it is called phobia. In short, phobia is an intense, irrational fear of some object or situation. There are various subtypes of phobias: specific phobia, social phobia, agoraphobia, etc. Students, remember that overcoming phobia. The most effective way to overcome a phobia is by gradually and repeatedly exposing yourself to what you fear in safe and controlled way. During this exposure process, you will learn to ride out anxiety and fear until it inevitably passes from your life. Second disorder is called as depressive disorder. In the total population, 5 to 6% of people suffer from mild depression due to some negative incidences or some other external factors. The individual may experience negative feelings, but if it continues for a very long time, then it is called depressive disorder. Feelings of hopelessness, anxiety, and sadness are the major feelings experienced in this disorder. Students, the disorder in which the individual experiences extreme feeling of sadness as well as guilt for at least 2 weeks is called as depressive disorder. Now, what are the symptoms of depressive disorder? Feeling of hopelessness, lack of enthusiasm, weight loss, lack of interest in food, and loss of appetite, either lack of sleep or excessive sleep, constant feeling of fatigue, sad feelings, excessive feeling of guilt over some matter are found in the individual suffering from depressive disorder. Now, what can we do in this situation? Look for support from people who make you feel safe and cared for. In depressive disorder, you have to have people around who are very supportive to you. Secondly, the simple act of talking to someone face to face about how you feel play a big role in relieving your depression and keeping it away. Find some ways to support others. Do something nice for others, and this will help you to feel that everything is fine with me. The next one we are talking about is called as bipolar disorder. Now, this is also called manic depressive disorder. In this disorder, the individual experiences alternate phases of extreme sadness, hopelessness, stress at one time, and extreme happiness, enthusiasm, and elation at the other time. In the same individual, you can see these two opposite conditions, one after the other. That is why it is called as manic depressive disorder. Now, what are the symptoms? The individual experiences alternate phases of two states. One in which the individual is extremely happy, excited, and elated, and the other he experiences sad, distressed, losing hope, thinks unrealistically, and gets irritable or aggressive. Now, genetic factors: imbalance in neurotransmitters in the brain, mainly norepinephrine, serotonin, and dopamine, are found to be the main causative factors. Now the question that comes about, what is the common treatment given for these bipolar patients? There are 4 major keys. 1. Mood stabilizers. 2nd. Antipsychotics. 3rd. Talk therapy. And 4th. ECT, that is electroconvulsive therapy. Students, remember that there are 6 points to be noted in bipolar disorder treatment. What are they? Number 1. Stay connected. Number 2. Educate yourself. Number 3. Track the symptoms. Number 4. Engage in coping skills. Number 5. Establish a routine. Now what is this? Healthy daily routine like taking medicine regularly, taking proper sleep in night, regular exercise. And number 6. Develop a crisis plan. What is it? Contact your care people, those who care for you. Contact the doctor when you feel that symptoms are becoming severe. Students, today we have discussed about 3 psychological disorders. 1. Anxiety disorder. 2nd. Depressive disorder. And 3rd. Bipolar disorder. Let us go through the quote. It says, self-care is how you take your power back. I repeat, self-care is how you take your power back. Students, do reread the lesson for better understanding. Thank you. Have a nice day.